If you are pregnant and you bend down to pick something from the floor without thinking about your posture, you may be putting unnecessary strain on your back, your pelvis, and even your overall balance. Many pregnant women do this multiple times a day without realizing the long-term effects. In this video, we are going to take our time to fully understand the correct and incorrect way to bend during pregnancy, why it matters so much, what is happening inside your body, and how small changes can make a big difference in your comfort and safety. Pregnancy brings many changes to your body. Your weight distribution changes, your posture shifts, and your muscles and joints work differently to support your growing baby. Movements that once felt easy, like bending down, can suddenly feel uncomfortable or even painful. This is not because your body is weak, but because it is adapting. Learning how to move correctly during pregnancy is one of the best ways to support these changes. This video is for all pregnant women, whether you are in your first trimester, second trimester, or third trimester. It is especially helpful if you experience lower back pain, pelvic pain, hip discomfort, or fatigue after doing simple daily tasks like bending, picking up objects, or cleaning. Even if you are not experiencing pain yet, learning proper posture now can help prevent problems later as your pregnancy progresses. Let us first talk about the most common mistake pregnant women make when bending. Many women bend by folding forward at the waist. The knees remain straight, the back rounds forward, and the belly moves outward. This may feel quick and convenient, especially when picking up light objects, but during pregnancy, this movement places extra pressure on the lower back and pelvis. As your baby grows, your center of gravity shifts forward. This means your spine and pelvic muscles are already working harder to keep you balanced. When you bend at the waist, the muscles in your lower back stretch and strain more than they should. Over time, this repeated stress can lead to persistent back pain, muscle fatigue, and a feeling of instability. You might notice that after bending this way several times in a day, your lower back feels sore, tight, or tired. Some women describe a pulling sensation, while others feel sharp discomfort when standing back up. These are signs that your body is under strain and needs better support. Inside your body, incorrect bending affects several structures. The spine becomes compressed, especially in the lower back. The abdominal muscles overstretch, which can weaken their ability to support your posture. Pressure also increases around the pelvis, which may contribute to pelvic girdle pain. The uterus shifts slightly forward, and although your baby is protected, repeated strain can make movement feel uncomfortable and unstable for you. It is important to understand that pain is not something you should ignore during pregnancy. Pain is your body communicating that something needs to change. Proper bending technique is one of the easiest and most effective changes you can make. Now let us talk about the correct way to bend during pregnancy. The key principle is simple. Bend at the knees and hips, not at the waist. This movement allows your larger leg muscles to do the work, while your spine remains supported and aligned. Start by standing with your feet shoulder-width apart. This wider base gives you better balance. Slowly bend your knees while pushing your hips backward, as if you are about to sit down. Keep your chest lifted and your spine straight. Avoid rounding your back. Engage your core gently, not by tightening forcefully, but by maintaining awareness and control. As you lower yourself, breathe out slowly. Breathing helps reduce tension and supports smooth movement. Pick up the object while staying low, then rise back up using your legs. Take your time. There is no need to rush this movement. Using this technique reduces pressure on your lower back, improves balance, and protects your pelvis. Even when picking up light objects, correct technique matters because small movements repeated many times can lead to discomfort. Now let us compare the incorrect and correct positions side by side. In the incorrect position, the back is rounded, the knees are straight, and the belly moves forward, pulling the spine out of alignment. In the correct position, the knees are bent, the hips move backward, and the spine stays neutral and supported. One posture places strain on your body, while the other supports it. Even when using the correct bending technique, there are still common mistakes to watch out for. One common mistake is allowing the knees to collapse inward. This can place stress on the hips and knees. Another mistake is rounding the back slightly, especially when tired. Some women also hold their breath when bending, which increases muscle tension and reduces stability. To avoid these mistakes, move slowly and mindfully. Focus on keeping your knees aligned, your spine straight, and your breathing steady. If needed, use a chair, wall, or countertop for support. Using support is not a weakness, it's a smart way to protect your body. Now let us talk about how bending fits into daily life. During pregnancy, you may find yourself bending frequently to pick up items, care for other children, or complete household tasks. Repeated bending without proper technique can lead to cumulative strain. If an object is too low or too heavy, ask for help. If you need to pick something up from the floor, consider placing one knee down if it feels more stable. Avoid twisting while bending, as twisting places extra stress on the spine. Instead, face the object directly and move your whole body together. Remember that your body is doing important work. Supporting it with proper movement helps you feel stronger, more comfortable, and more in control. There is no perfect way to move, but there are safer and more supportive options. If you found this video helpful, like, comment, and share.